Today, we're going to talk about an institution that's so much more than just a school. I mean, for millions of people, it's literally a lifeline. This is the story of Ayub Medical College, a genuine pillar of healthcare in Pakistan. So let's start with its core purpose. Because to really get a handle on its impact, you have to understand this. From day one, this was never just about classrooms and textbooks. It was about serving a fundamental human need across a huge and often overlooked part of the country. To serve the ailing humanity. Think about that for a second. That's not just some nice-sounding phrase on a plaque. It's the mission. It is the very DNA of the college. For decades, this one powerful idea has been the driving force behind every single student, every doctor, and every decision made there.
And if you want to understand the sheer scale of their work, just look at this number. The college's teaching hospital is the main advanced care provider for over 5 million people. For this massive region, when things get serious, this is where you go. It's the last stop for the most critical health problems.
So, to put it on a map for you, Ayub Medical College, or AMC as it's often called, is a public institution located in the city of Abbottabad. But here's what's really key. It's the second oldest medical college in the entire province. That status gives it this deep historical significance in the country's medical story.
But okay, how did this all even start? To really appreciate what AMC is today, we have to rewind the clock and look at its ambitious beginnings. Back to a time when a critical problem sparked a truly revolutionary idea.
You know, places like this don't just pop up out of nowhere. AMC was born out of pure, undeniable necessity. Back in the late 60s, a government study flagged a major gap in healthcare, especially in the Khyber Pakhtunkhwa province. There was this urgent, desperate need for a top-tier medical school way outside the big usual city centers. And the growth didn't happen overnight. It was this steady, deliberate build. The official decision was made way back in '72. By '79, you had the first class of 100 students starting their journey even in a temporary building. Then in 1990, the brand new purpose-built campus finally opened. But the real game changer? That came in 1998 with the opening of its own massive teaching hospital, which completely transformed the hands-on training for every single student. All right, so let's fast forward. What has all that history turned into? Let's take a look at the campus as it is today, a sprawling, thriving hub of learning and healing. And wow, the sheer breadth of knowledge here is just incredible. Students start with the foundational stuff, the basic sciences, before they dive deep into specialties ranging from pediatrics and cardiology all the way to something as complex as neurosurgery. We're talking about a truly comprehensive medical education, from top to bottom. And who's learning all of this? Well, you've got this vibrant community of about 1,350 undergraduates. These are the next generation of doctors and dentists. And alongside them are 150 postgraduates, who are already becoming the specialists and the leaders that are going to shape the future of medicine in the region. You also have to picture this setting for all this hard work. The campus covers 130 acres, and it's nestled right in a valley, totally surrounded by the beautiful Sarban Hills. You can just imagine how that kind of serene, focused environment would be perfect for the intense job of studying medicine. But here's the thing. AMC's influence doesn't just stop at the edge of its campus. Over the years, this college has built a reputation that reaches far, far beyond the borders of Pakistan. Okay, so you see these names on the screen. The World Health Organization, the ECFMG in the US, the GMC in the UK. What does that actually mean? Well, it's huge. It means a degree from Ayub Medical College is like a global passport. It allows its graduates to go on and train and practice medicine pretty much anywhere in the world. And get this, the college doesn't just teach medicine, it actively contributes to it. They have this prestigious, peer-reviewed research journal that's indexed on major international databases like PubMed. That gives it some serious credibility. It was also a real trailblazer. The very first medical journal in all of Pakistan to be available for free, online, with full illustrations. But when you boil it all down, the college's truest legacy is human. It's the thousands of doctors it has produced. They even have a name for themselves, Ayubians, and they are the living, breathing embodiment of that founding mission. You'll find them working everywhere, from tiny rural clinics to leading city hospitals, and contributing to health systems all across the globe. So, this all brings us to the big picture. The college's lasting impact, and, just as importantly, its vision for what comes next. It's all about building on that powerful foundation to shape the healthcare of tomorrow. You want to know what service to humanity really looks like in the real world? Nothing makes it clearer than what happened in 2005. When that devastating Kashmir earthquake struck, it was the Ayubians, the faculty, the graduates, who were right there on the front lines, providing life-saving medical care in absolutely impossible conditions. It's a moment that truly defines their legacy.
And this story is still being written. I mean, there's this huge piece of news from just recently. In December 2023, the Prime Minister of Pakistan announced that Ayub Medical College is going to be upgraded to a full-fledged medical university. This signals a whole new chapter, promising even greater influence in research and education for the entire region.
So, we end up with this question. How does one college change a nation's health? When you look at the journey from a government study that identified a need to a sprawling campus serving millions to a future as a major university, the story of Ayub Medical College gives us the answer. It shows us how a single institution, driven by a crystal-clear mission, can truly change the health and the future of an entire nation.